Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Gary back in here with us this afternoon for his 6th and final adjustment here at Advanced Chiropractic Relief. We've been seeing him twice a day since Monday, and this will be his 6th adjustment. Gary, would you mind sharing with our crack addicts how you've done this first 3 days, and tell them how you came in and what you couldn't do before and what you're able to do now, because that was really intriguing to me this morning.
Yeah, so before coming in here, I really thought surgery was the only option. It was what I kind of been told, and so I've seen his videos, came up here, made the decision to get up here and do it, and my best decision of my life. There were just simple everyday things that was painful for me to do this morning I could do with ease. One of them is just putting on shoes and socks without any lower back pain.
Or having to hold yourself on
the
side.
Yeah, hold myself, brace myself for sneezes.
Yeah.
That's what I used to have to do because it felt like my whole bottom of my back was going to blow out. And no, it's been life changing.
And you and Yolanda came over here from Amarillo,
Yep.
right, to get your care.
Yeah, we did. So
it was a leap of faith on you guys' part to come here in the first place.
Yes, yeah, that's very true. Wife was very open to it. She knows what I go through on a daily basis, and whenever I told her what it felt like I needed to do or needed to be done to me, and seeing the videos online, it's like that's for me.
Well, she watched you get adjusted on Monday, and then decided to get her first adjustment yesterday. It was out of this world.
Yeah. Oh yeah. Yeah. Well,
that was the best post-adjustment comment I've ever heard in my whole time being here in Houston.
Yeah, it was good.
That was wonderful.
It was.
But you know, he brings up a real interesting point, because if a surgeon or a neurosurgeon or orthopedic surgeon or spine surgeon tells you that the only answer for you is to have back surgery, guess what? It's not the only answer. They're decompressing the spine surgically, decompressing the spinal nerve roots and the spinal cord surgically. We are decompressing the spine on the y-axis non-surgically, which also takes that pressure off the nerves. And in Gary's case, the sciatica that was appropriate or coming along with his lumbosacral subluxation complexes and disc herniation.
Yep.
You know, so surgery is not the only option. There are conservative, non-drug, non-surgical procedures such as this manual spinal decompression on the y-axis, the ring dinger, that helps people to get the compressed nerves free again, and then start living their lives normally the way you did. And they all went down. Yeah. They went down to Irma's today and brought us back some tamales. So thank you, Irma, and thank you, Tony, for bringing them back. We thank Gary and his wife Yolanda for doing that for us. Renee and I are going to have a feast this afternoon.
Y'all are busy.
It's good stuff. Yeah, we don't get to eat till early. Renee and I are early risers, and you know, I got to just share this real quick. BJ Palmer is one of my chiropractic heroes, and he came up with the line way back in the 30s that said, early to bed, early to rise, work like hell and advertise. Well, we don't advertise. We do videos showing people what we do with the chiropractic adjustments here at Advanced Chiropractic Relief. That's our advertisement. We're not selling anything here except chiropractic adjustments. And it's a 100% natural, and I've never tried to sell you anything while you've been here either, except for Irma's.
Nope. That was worth it.
Yeah. So anyway, this is his 6th adjustment, so we're going to get to it. Let's have you close your eyes and flex your head forward and backwards for me, please, Gary. Wow, look at you in the mirror. You right down the gut, X, Y, Z. When you're neutral, x-axis, y-axis, and z-axis, your spine is strong and stable, and you're not going to be pinching on the nerves, which is just, that is the entire essence of my technique. The Johnson chiropractic technique is X, Y, Z neutrality. Because when you're subluxated on the X, Y, Z axes, you're going to have biomechanical improprieties, and you're going to have nerve compression, and you're going to have dysfunction as a result of that nerve compression. And Gary, like thousands of other patients who come here, are seeing non-surgical, non-drug related type of relief. And that's why we're called Advanced Chiropractic Relief. Okay, let's go and you tell me for me first. Oh, you know what? I don't know what I'm doing, Gary. Let's do this one first. Ring dinger first. I got off.
You're throwing me off.
I got thrown off by my own talking. Sometimes I talk too much, I just can't help myself. But hopefully you found this week educational too, on things to do and not to do, how to sleep properly with your legs elevated.
Yeah.
Do your extra
Figured out how
homework,
to actually do that.
your homework and exercises.
Oh, yeah.
Yep.
Yeah,
There we go.
Yolanda we were both doing her shoulder.
Yep. It works. The people who actually follow my homework recommendations, they get well quicker and they stay that way longer. So our whole goal is to get the results for you so that you can get back to living your life and going about, and you just come back over here when you want to tune up.
Yep.
And eat hummus.
Yeah, and eat dermis, that's right. There we go. And a gallon of water keeps the doctor away. Gallon a day keeps the doctor away. I don't know where they came up with that apple a day crap. There. Okay, tilt right a little. There you go. Perfect. Gary's getting the hang of relaxing a little bit better. Because you know I'm going to win anyway. Might as well just let me have it.
Exactly.
Perfectly even. That really shouldn't have hurt at all, Gary.
No.
Okay, great. Your leg did get a little short when I brought it up, so there's still a little tweak on your right SI right here. Yes, sir. Yep. Boy. Yes, sir. See, I'm getting where I can catch you between busts now too, Gary. Perfect. And see, they stayed even that time. That didn't tighten up, did it?
No.
Okay, good. There we go. There we go. Good. Okay, let's turn you on your back, please, sir. Good, okay, now let's have you put both arms out, palms up. See, you're just now getting all of this down, all the positions and everything, and then you're gonna leave.
Yeah.
Okay, let go here. There we go. Perfect, okay. Now let's sit you up, face towards Yolanda. There we go. That's it. Okay. Yep. Very good. Okay, let's stand you up here in front of the mirror. Okay, so I'm just going to stretch these out here, Gary, and I'm going to bounce your muscle spindles again. Well, you're not near as jumpy as you were on Monday.
No.
You hold these guys here. There. There we go, okay. Try that same maneuver again now, Gary. Tell me if you feel any hang-ups anywhere.
No. No hang-ups.
Well, you've got a couple of children back home you could say a shout out to. What's their names?
We've got Ashley, Hope, Gary, and Caleb.
There you
and then
go.
grandkids, Cora, Soren, and Alec.
Boy,
He's a new
good
one.
job.
He's a newer one. Yep.
Good
yep.
job. So this
So
big
give 'em a
shout out
shout
from
out.
Houston.
Yep.
And we're glad to be able to send Gary and Yolanda back home, not having to go resort to having surgery and taking pain pills and muscle relaxers all the time, and they can live their lives pain-free without drugs and surgery now. So We're happy to have them here. Thank you for
Yep, thank
giving me
you.
the opportunity to come over this week,
Oh,
or
thank
you to come over and
It was
let
well
me
worth
do
it.
this. Good,
Well worth it.
good. Okay, now we're gonna do Yolanda on the same video. Okay, right there. Okay, this is Yolanda's second adjustment. Let's have you close your eyes for me, Yolanda, and bend your head forward and backwards. And then neutral, there you go. So you're straighter too, your head's still a little forward. That's that big pillow you're still sleeping on.
I did see one.
I know. Okay, so let's do this one first on you today too. Alrighty, pelvis right here. Okay. You know, I think if people knew that they didn't have to have surgery, who would want to have surgery when you could do it naturally?
Oh.
Yeah.
I don't know anybody that would want to.
No.
Not in their right minds anyway. Not unless they're on the surgeon payroll or something. Okay. And then I don't think they don't even like operating on their own family, or their family don't want to get operated on either.
No.
We take care of pharmacists and physicians all the time that don't want to have those drugs and surgeries in their lives. But they don't like to tell anybody else about it. So we don't use video of those guys. Okay, nice deep breath for me now, Yolanda. Perfect. Now see, I didn't have to use as much force on her because she's a lot smaller than Gary. But you felt that all the way down, didn't you?
Yes.
Look at there, you're still kicking. When I did Gary's very first ring dinger, Yolanda's eyes got as big around as that flying saucer she came over.
And I thought, no way, I'm gonna let him do that to me.
Yeah, and look at you now.
Uh-huh.
Here we go. Now you got understanding for me. And Gary did good remembering all the kids' names and grandkids' names.
Yes,
That was
he did.
putting him on the spot. He did good. See, it makes your mind function better too. Okay, slide down this way just a little bit for me. There you go. There we go. Yes, ma'am. Yes. See, it doesn't require the same forces to adjust smaller spines that we do when you get big guys in here. Did that hurt at all, Yolanda?
That feels good.
Okay. There you go. Okay, let's turn you on. This is a message for you crack addicts. Y'all be kind in the comments or I'll disable these comments in a heartbeat. Isn't that right, Yolanda?
Yes.
Good. Okay, slide down this way. You act like they'd never seen a woman before. His ribs aren't as sore as they were yesterday either. Or Monday. Oh, no, it was yesterday, wasn't it?
Yes.
There we go. Now, one of Yolanda's wish list was to be taller, so I'm trying to accommodate her. Let me help you up here.
Oh.
That's it. You relaxing better for this adjustment too? Good for you. Yes, ma'am. You just noisy all over, aren't you? How do you spell relief?
Oh, gosh, right?
Crack.
Yes.
So see, being a crack addict has its advantages. Okay.
Yeah.
Alright, let's shoot you now. Okay, I'm gonna have you close your eyes and flex your head forward and backwards again. See, she flips her hair a lot, that's why her neck's out. A lot of women do that. Okay, knees up and back. No, hold them up there for me.
Okay.
There you go. Now back here. Okay. There we go. Okay, let's have you close your eyes and flex your head forward and backwards again, Yolanda. This should feel like it's on a swivel. Full range of motion.
Yes.
Did that hurt?
No, I feel great.
Great.
I feel really good.
So Gary got relayed how he's done here
Yes.
over his last 3 days. How would you share with our crack addicts that you've done in your 2 adjustments that you've had here?
That I've been able to sit still and not adjust the way I'm sitting due to pain in my left hip, this sciatic nerve. I had to kind of switch to one side. to
Yeah,
sit
because you were
properly.
sitting on one side of your rear and leaning pretty bad on Monday.
Yes, and usually I would have to at least once or twice, then I can sit still and
Mm-hmm.
not
Good.
move side to side.
Are you able to sleep better too?
Oh, yes.
Yeah, good, good.
Well,
So if you're a crack addict and you're thinking about coming here to Houston, Texas, get on our website at advancedhoustonchiropractor.com and fill out a new patient request
Yes.
form. Did Renee get back to you guys in a timely manner when you did that?
Oh, yeah.
Okay.
Yeah.
There's one way to be assured that you won't be seen here at Advanced Chiropractic Relief, and that's to say, do you take Blue Cross Blue Shield of Texas or United Healthcare? We do not take insurance here, and Renee's getting 80 to 125 emails a day requesting new patient appointments. So we have to filter through those and pick out the patients who want to be well. We only treat people that want to get well too. We're not going to treat car accidents or workers' comp patients just because that deals with the insurance, so we don't do that. Plus, those people usually don't want to get well as quickly as somebody who's paying out of pocket.
Yeah.
And if you're a whiner, definitely don't call or don't email us. You gotta be a tough cookie to get through this, huh?
Oh,
Yeah. Oh, yeah.
Well, anyway, we do welcome you if you're going to come here for the right reasons. I do not treat diseases here, so don't ask us if we treat acid reflux or hiatal hernia or GERD or cancer or heart attacks or stomach problems, because we don't. We treat the vertebral subluxation complex of the spine and extremities, and we adjust you in the XYZ axis to help your body function at its most optimal level of health. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.